What if I told you the COVID vaccine may have done more than stop a virus? What if it also quietly reduced heart attacks and strokes worldwide? It sounds like a bold claim, but the data is pointing towards something truly remarkable. When COVID-19 hit, the world went into lockdown. The mission was simple: stop the virus, save lives, and get back to normal. We developed vaccines in record time, and billions of shots were administered. But years later, as scientists analyzed global health data, they noticed something unexpected. After the mass vaccination campaigns rolled out, rates of severe cardiovascular events like heart attacks and strokes began to decline. This wasn't just a small dip. It was a noticeable, statistically significant trend observed in multiple countries. It was an unexpected medical trend that demanded a closer look. Let's dive into the shocking data. Multiple large-scale population studies, looking at millions of patient records, found a consistent pattern: fewer hospital admissions for cardiovascular emergencies after vaccination campaigns gained momentum. Now, you might think, well, that's because vaccines prevented severe COVID, and we know COVID is hard on the heart. And that's true. But here's the kicker. The study suggested a reduction, even in heart events that were indirectly linked to a recent COVID infection. It appeared that vaccination was associated with a lower baseline risk. This wasn't about avoiding COVID alone. Even non-COVID heart attacks and strokes dropped. The data was clear. In the post-vaccination era, something was protecting people's hearts and blood vessels. So, how could this be possible? How can a vaccine designed for a respiratory virus affect your cardiovascular system? The answer seems to lie in one key word: inflammation. Heart attacks and strokes are often triggered by severe inflammation, which can destabilize plaque in your arteries and cause dangerous blood clots to form. We know for a fact that a severe COVID-19 infection sends your immune system into overdrive, creating a massive inflammatory storm that dramatically increases the risk of these events. The vaccines, on the other hand, train your immune system in a much more controlled way. They teach it to recognize the virus without causing that widespread, damaging inflammation. By reducing the body's overall inflammatory state and preventing the severe immune overreactions caused by the virus, the vaccines may have helped stabilize blood vessels and prevent the formation of those life-threatening clots. Essentially, less inflammation means a lower risk of a cardiovascular catastrophe. This discovery is genuinely challenging how we think about vaccines and their role in medicine. Traditionally, we see them as tools to prevent a specific infectious disease. But what if their benefits are broader? What if, by moderating our immune response, vaccines can also help protect vital organs like the heart and brain from other threats? This opens the door to a new era of preventive health. Imagine a future where vaccines are part of a holistic strategy to not just fight viruses, but to lower the risk of chronic conditions tied to inflammation. This could completely change the game for public health. For high-risk populations, like the elderly or those with pre-existing conditions, this potential secondary benefit is massive. Heart disease is one of the world's leading killers, responsible for millions of deaths every year. If a simple, widely available vaccine can contribute to reducing that burden, it could reshape our entire approach to prevention. It's a powerful reminder that the benefits of public health initiatives can sometimes ripple out in ways we never anticipated.